Aggression, this is addressed in your book, so I'm just going to make a couple of comments about this. Aggression is like a fever. It's a symptom that's seen in so many different kinds of disorders. And so, you know, the treatments for this are going to, there's a multitude of treatments, and bottom line is none of them are very good, okay? And you can get this obviously with a whole bunch of different kinds of disorders. But the way to go is to, if you're going to use medication, it is really to say to the patient and or their family, there's not one single drug that's been shown to be effective across the board, but what we're going to do is we're going to start treating with medications, and we're going to systematically go through trials of medications to see which one works. Now, for instance, I mentioned this in the very first class, beta blockers. 90% of people that take beta blockers, it doesn't do anything except lower blood pressure, but 10% it actually works very well. So if you look at the overall 10%, that doesn't look very good in group studies, but that may be, in that 10%, it may be what keeps this guy from killing his wife. You know? So I think, but the name of the game is systematic. Drugs like lithium have been shown to be effective in some cases of out-of-control aggression, but it's certainly not top of the list because it's got so many side effects. It's very hard for people to have to go through all the laboratory tests, and so you're constantly trying to figure out, okay, which one do we use first, what's the highest yield? Now, probably what has now become the top of the list are atypical antipsychotics. And that's one thing we talked about this, I think, last week when we talked about bipolar disorder. These drugs really are probably the best for a broad range of disorders that have aggression as a primary feature, okay? Now, my biggest concern about this, and it's a personal concern, but when I've given talks to nurses, especially school nurses, is that because these drugs are really pretty effective in treating aggression, they're being used a lot with kids. And kids are aggressive for a lot of reasons. I mean, you can have psychiatric disorders, okay, like oppositional defiant disorder, some severe case of ADHD, bipolar disorder, and so forth. But also there is a multitude of, you know, just psychological adjustment disorders where people are aggressive for any number of reasons. If the drugs were benign, that would be a different story. But, you know, as we know, they can cause weight gain, they can huge increases in cholesterol and stuff like that. So I think there's some concern about, you know, like 25 years ago, everybody's worried about too many prescriptions for tranquilizers. Well, I think especially among inner city kids and lower class kids that don't get followed and really monitored effectively by the medical care providers, just routinely prescribing Seroquel or Risperdal, Risperdal is probably the one that's been used the most, but without really monitoring that carefully is not a good idea.